What is patient family-centered care? Why is it important? It allows patients and families to participate in their care. It's part of decision making, and it also provides dignity and respect for patients, as well as information sharing. And the bottom line, it also makes it better for patient safety. We all need to embrace this for better outcomes, for reduced readmissions, reduced infections, and also reduced errors. This is the right thing to do. It's a change for healthcare that benefits all parties. Really put yourself in your patients' and families' shoes. Hopefully you're already doing this. If not, it will be a change in your approach to coworkers, patients, and their families. From this day forward, make this commitment, starting today. Make it part of your care to partner with your patients. Tell them that it's okay to ask anything, that you're there for them, and as a team, we're going to help to provide the best care possible.
As a nurse, I want my patients to feel comfortable. I want them to know that they can ask me absolutely anything. Why? Because I think overall they will have a safer stay and a better experience. I may look busy when I walk into a room, but I still want them to know that it's okay to ask questions about their care and it's okay to ask for help. Our body language is a very important factor, and oftentimes with our body language, I think that we show that we don't want them to ask. When I walk into a room, I introduce myself and I tell my patient how long I'll be there with them. I want to include their families in their care. Why? Because I want them to have the best experience possible that they can have.
Hi, Mrs. Conrad. My name is Angel. I'm going to be your nurse until 7 tonight. I want to let you know if you have any questions, you can let me know.
Okay, Angel, I do have a question.
What's that, Mrs. Conrad?
I'm supposed to have an IV, and I just want to know what time they're going to come in and give it to me.
Well, Mrs. Conrad, I'm very busy. I've got a very big assignment tonight, and I've got some people not doing really well. So I'll be back in a little bit, okay?
But what if I don't get it in time?
Mrs. Conrad, I don't want you to worry. I don't want you to worry.
I'm not asleep for my surgery, so what time are they going to give it to me?
I'll be back later, and we're going to go over all of that. Don't you worry. I'll be back,
But
okay?
I wanted to kind of have an idea of when they'll be here, so I'm not in the bathroom or anything.
Mrs. Conrad, it's going to be fine. It's going to be fine. I'll be back.
But come on in.
Hi, Mrs. Conrad. My name is Whitney. I'll be your nurse till 7 p.m. tonight. Did you have any questions for me?
Actually, I really do.
Great.
I'm having my surgery this afternoon after lunch, and I haven't had my IV started. And they told me that that would be one of the first things that happens when I got to the hospital. So I'm concerned that they're not going to be up here in time, and if I'm not going to, I won't be totally asleep before my surgery. So I just wanted to know what's going to happen with that. Will they be able to? When will they be here to do that? And is it going to hurt? And I just want to know a little bit more about what's going to happen with that.
Right. I totally understand. I'll be back in about 30 minutes to start your IV.
Okay.
The doctor and anesthesiologist are going to come up and further explain your procedure. They'll go over what drugs they're going to use to put you to sleep, how long the procedure is, and things of that nature.
Okay.
So just to ease your mind, it's definitely okay to ask. We're all here to help you, okay?
Okay.
Yeah, and if you had any more questions, there's a call light button right here and also on that side. So if you have any other questions
so
about your
I can
surgery,
call you whenever if I have any more questions, and then you'll come back and answer them?
Yes, definitely.
Thank you. I feel a lot better knowing that.
I'm glad.
When my first nurse came in, I don't even know who she was. She just wanted to get out of here. She told me that she had a lot of patients and that she needed to get moving, and I didn't have any time to ask her the things I wanted to know. I asked her, but she didn't have the time to answer me. She just wanted to go, and that made me more anxious because I didn't feel like I was important. I felt like I was just a number here. When Whitney came in, she was my second nurse. She made me feel so much better because she took the time to tell me what was going to happen, what time I was going to get my IV, and she told me that I could ask her anything I wanted and that she had the time to answer my questions and that I could call her whenever I wanted and she would come back and answer my questions. That was really very comforting.
I've worked here for many years. I know how important it is to allow people to ask me questions. I think they feel more comfortable talking to me. I can then direct them to the person they need, encourage them to ask questions. All it takes is a smile and let people know that you care. I like being a part of this team and allow the patient to ask me questions so they can be safe, and then they can allow them to get the best care.
Patient-family center care is not something to try today and abandon tomorrow, or even later. It needs to be part of your interaction with each patient always. This elevates our care and keeps our patients safe. Making a patient feel comfortable to ask questions will enhance your performance as a caregiver. We all need feedback, and your patient's questions might just save their life.